Hello everyone, I'm David, and welcome back to another First Aid Skills video. In this week's video, we're going to be talking about strokes. Now, a stroke occurs when blood flow to a certain part of the brain is interrupted, which causes cell death in that part of the brain. Now, strokes can cause permanent damage to the brain. However, if they are caught quick enough, the damage can actually be reversed or just stopped right there. So there's three different kinds of strokes. You can get a stroke from a ruptured aneurism, which would be a hemorrhagic stroke. So hemo being blood. So that would be with an aneurysm, you have your artery. An aneurysm is a weakened part of that artery, and so it starts to bulge out because it's thinner there, and then it bursts, which is a ruptured aneurysm. So when an aneurysm bursts, the part of the brain doesn't get the blood from that artery because now this blood is leaking out just into the brain, which causes cell death in that area. There's also blood clots, which would be an ischemic stroke. So that's similar to a heart attack, just in the brain, where that artery has a clot and is blocked, and therefore blood flow has been interrupted to that part. And there's also brain tumors can cause strokes. So with the brain tumor, the cells multiply and grow and put pressure on the arteries in that area, which can actually pinch them off, and that's how blood flow is restricted in that area. So when looking for signs of strokes, a person experiencing a stroke may have a sudden or severe headache. They may get very dizzy and confused. They may drop and be unresponsive, or they may lose control of their bladder. As first aiders, when we're trying to recognize a stroke early, there's an acronym we use, which is F.A.S.T. F is for face, A is for arms, S is speech, and T is time. So when you're looking in the face, strokes typically affect one side of the body. So if you're looking at their face, you'll see the person's eyes will start to get droopy because the muscles that support holding the face up are being affected and start to drop. Their mouth may start to drop in one side, and so this is kind of what you want to look for in the face. With the arms, easy one. Their arms will be in front of them. Ask them to just lift their arms up. If the right side of their body is affected, their left arm will come up and their right won't move. And if the left side's affected, the opposite will happen. So only one arm they'll actually be able to lift up and control. S is speech. So since the muscles in the face aren't working well, they won't be able to control their speech as well. So they'll start to slur their words and it'll be really hard to understand them. And T is time. So with time, we want to mark down the time that we realize these symptoms start to occur. The reason we want to do this is because it's good to keep track of how long a stroke has been going on. And also there's certain medications that 911 uses that can only be used in a certain window of time. And so it gives them an idea of whether or not they can use these medications or if they have to try something different. Now, with strokes, as first aiders, there's only so much we can do. Really, all we can do is call 911, get an AED in case we have to use it if they become unresponsive and stop breathing, or if their heart stops and we have to use an AED. And we want to put them in a position of comfort, so leaned up against a wall or something. We don't typically want to lay them on their backs because if they do go unresponsive, now we have to worry about choking hazards with their tongue or their saliva. If they are unresponsive, we want to put them in the recovery position on their side, which is what we learned a little while ago. And then we want to monitor the person. So never lay them down and leave them. We want to stay with them and keep track of what's going on with their body. And if things change, we'll probably still be on the phone with 911, update them as things do change. Now, there's also a thing called a transient ischemic attack, or a TIA, which I'll refer to it as because it's hard to say. So with a TIA, someone who experiences one has the same symptoms as a stroke. However, these symptoms just vanish. So a TIA, an example, would be caused by a clot got lodged in an artery, cut off blood flow to the brain, and they started to get affected by the stroke, and the clot broke off and left somewhere in the body, and now all their symptoms are gone because now the blood's getting flow, or the brain is getting blood flow again. So anybody that experiences a TIA, you still want to call 911 even though the symptoms left. 10% of people that have a TIA will have a stroke in the next 3 months. And half of these strokes happening within 48 hours. So it's still important that we call 911, follow all the same steps, keep them comfortable, monitor them, follow all that F.A.S.T to the face, arms, speech, time. Even if they come out of it, still have them go to a hospital to prevent a future stroke attack. So that's pretty much it for strokes. Thank you all for coming to this week's video, and I hope to see you all next week. Thanks.